Hi, my name's Jade. I am a registered nurse from Australia and I have been nursing for 18 years and 10 of that has been internationally working in rural and remote countries and remote villages, and 6 of those years was in Guatemala. I used to be the director of Nursing Heart, and it was probably my favourite job that I have ever had, because we empower nurses and nursing students both from Guatemala and from other countries to really be to the roots practitioners. So practitioners that can actually work in an environment that they do not have the resources that Western world does. So these nurses and nursing students, they come in and they are looking at patients that have, say, tummy pain, and they have no access to blood tests, they don't have access to ultrasounds. So they really have to use their theoretical and their practical skills that they've learned in their own country and really apply it and look at the person and the community as a whole. Look at culturally what is impacting this stomach pain. Look at physically, public health, community health. Look at, have they got access to running water? Have they got access to schooling and food and shelter, and what sort of things are actually impacting this patient, and then making a diagnosis instead of doing their physical assessment, doing a little bit of a health history, and then doing some blood tests. So that is one of the biggest benefits and bonuses of having a global health practicum, especially with Nursing Heart. And the other thing is that they really get this cultural awareness. And so, you know, nursing, we are so focused on international health, global health, public health, and cultural health, right? So we are there to treat people from all cultures and from everywhere without judgment. And really, to nurse somebody from another culture of your own, you really have to have this cultural understanding, and that can't be learnt from a textbook. That really can't be learnt properly from nursing someone from a different culture in your own culture. You know, so if you see a patient that's from the US and they're from another country, but you're nursing them in your environment, in your hospital, well, you can build a little bit of cultural empathy and a cultural awareness in that, but it's totally different to actually take the nurses and the practitioners out of their cultural environment and take them in and see someone else's. And not only then do you get a really complex understanding, you get complex empathy, and you also can then apply that when you go back. And that is what's going to shape nurses and make nurses of the future world, because we all need to be global health practitioners, whether we choose to work internationally or not. With the way that the world is, no matter where we are, where we work, we really need to have this cultural awareness. And finally, the thing that coming here to Guatemala with Nursing Heart is just seeing the relationships that Nursing Heart has with the community, how we support the community workers, the leaders. We don't want to come in and just be the solution to the problems with our healthcare. We want to teach and train and support, and that's what the nurses get to also contribute, and they get to also see is a non-profit that functions both with providing the international visitors with an amazing practicum and learning experience and re-instilling that love of nursing, but also re-instilling passion and love of health and love of nursing into the communities, the health workers, and everyone that we touch. Love Nursing Heart. It is the best organisation I have ever worked with or seen.